chronic kidney disease or chronic kidney failure often presents with few symptoms in the early stages. However, if the disease is left untreated, it can lead the patient to dire consequences. And here with more is Dr. Eduardo Alas with the Sandoval Regional Medical Center. Always get caught up on that.
Good
now, first question, what is chronic kidney disease?
Chronic kidney disease is a chronic ailment where the kidneys start to fail. They start to build protein in the urine and cause high blood pressure.
Now, what causes this disease?
Well, it's funny that chronic kidney disease causes high blood pressure, but chronic kidney disease is also caused by high blood pressure and diabetes. Advanced age tends to also play a role into it as well.
Okay. Now, is it something that we can prevent? Are there things that we can do to try and prevent this, or is it something that it's just going to happen?
Some folks are just predisposed naturally to chronic kidney disease, and those folks are the ones that you really want to catch to try to slow the progression to dialysis.
Okay. Now, we said earlier, it starts off kind of slow. There's few symptoms, but what are these symptoms that we should be looking for?
They're very nonspecific. So things like fatigue, less urinating, swelling of the legs. Those are the big things that you can sort of see early on.
Okay. And then what's the next step? If we kind of, feel a little bit off, what should we do?
Well, on a yearly basis, you should go to your primary care doctor and get a kidney evaluation.
Okay.
There are plenty of health fairs in our city where you can get you can pee on a stick and see if you've got protein in your urine to see if there's a protein in your urine to see if you've got chronic kidney disease.
Okay, so that's how simple it is.
That's how simple it is.
Okay, so they're not poking you.
There's no poking
or anything. Okay, so it's quite simple to check. Now, if somebody if they are diagnosed with this, what's their next step after that?
Well, their next step is a referral to a kidney doctor like myself, a nephrologist. And there we can do some blood work to see exactly what the cause of kidney disease. We can do some imaging studies like an ultrasound or a CAT scan. And if really needed, in few cases, we do kidney biopsies.
Okay, now what is, sorry.
Well, kidney
not
biopsy,
a doctor.
Oh, it sounds scarier than it is, but it's actually a very simple procedure where we take a very small needle, go into the kidney, take a very small piece of the kidney, and then put it under a microscope to see what's causing the disease.
Okay, great. Well, thanks so much. Now, if somebody wants to get a hold of UNM Sandoval Regional Medical Center, how do they do that?
Well, there's a general phone number. You can actually call in to our clinics. It's 925-8035 for centralized scheduling, and you can say, I want to see a kidney doc, and it's just as easy as that, and we see you.
Thanks. Easy enough. Thanks so much for coming in. Now, if you guys want to recap on what we just talked about, you can just head over to casa.com. But for now, we're going to send things over to Chad.